Legree. Again, you can find out more about us by logging on to our website at igbattmho.org. Again, this is It's Getting Better All the Time Mental Health Outreach, providing information and support while encouraging hope and faith. Today, I wanted to talk about challenges you may encounter when trying to receive services. Challenges you may encounter when trying to receive services. And again, there are a lot of them. We probably won't get a chance to cover them all or think of them all. So if you know of any that I haven't covered, if you can email us at support@igbattmho.org, that would be great. Again, always log on to our website. We have a lot of information and resources, and you can find out how you can support us, how you can support our work in the community. But again, what are some of the challenges that you might face when attempting to receive mental health services? Number one, let me lay like a foundation and say this. We are talking about services. Services is a little different from a product per se. Services really depend on, it's more personal, right? A can of soup, a can of Campbell soup in Nevada is going to be the same kind of Campbell soup in Ohio, okay? Because it's a product, it can, it doesn't change. But services do, because it really depends on the person. It shouldn't, but it does vary. It will vary depending on the person. It depends on the location. There are some things that you may find in your jurisdiction that other people may not have in others. So again, it's important to know that the services will vary. Okay, they will vary sometimes from day to day, depending on the interaction with the individual. So again, if you have, it's based on how you interact as well as the way the other person that you're speaking with interacts. So just kind of keep that in mind, because I know a lot of times we like to say it's the service provider's fault, and the service provider says it's the individual coming in for services' fault. But the bottom line, if both of us are coming in on a bad day, if both of us have preconceived notions, then we're going to bring that. If I am as a patient, and if I'm coming in thinking that all the doctors are out to get me, the nurses, they just want me to take the wrong medication, they treat me like I'm stupid, and I have those thought processes and preconceived notions even before I get there, right? Now, it may be true that's what happened in the last agency or the last hospital visit, but these are new people. So if I bring that with me, I'm going to be guarded, I'm going to be walled, I'm going to give off a certain energy, which in turn may cause the other people to respond in kind, and vice versa. So just kind of keep that in mind. So challenges that you might encounter. Number one, it's staff, okay? But I always put that little, caveat by that to say, yes, staff, but also, in fairness, keep in mind what we're bringing to the table as well. If we're bringing short-temperedness, if we're bringing irritability, if we're bringing anger, sometimes you run into some people may respond in kind, okay? So just keep that in mind. You may have staff. It's important to, when you seek out treatment, to know what you're looking for. What are you looking for? Why are you going to this particular provider? What are you hoping to accomplish with this visit? Right? These are some questions to ask, right? Because you may come in, a place where I used to work at, they had like different slots for the doctors depending on the needs of the patient. So depending on your need, when you call, what you said when you call, you may be put in a 15-minute slot, or you may be put in a 30-minute slot, or whatever. And if you get there, you talk to the person on the phone, they put you in for a 15-minute slot, and then you get there and your services require 30 minutes, then you may not be satisfied, right? Because you're going to feel like, oh, they're running, pushing me out of here, they, trying to get rid of me, when the bottom line, the communication wasn't clear, right? So again, just kind of keep in mind, what is it that you're looking for? So that's number one. Ask yourself, what do I need? We talked before about the importance of having a treatment plan, a crisis plan, the importance of having a plan, right? What do I need to sustain myself? We're talking about chronic illnesses. What do I need to live? What do I need to sustain myself? What do I need to What do I need to live, right? So you want to ask, what am I going for? Okay, what do I need? So again, it's important to know that. If you're going to, let's just say, a doctor's visit, this is your first visit, you want to ask yourself, what do I need, right? What is going on with me? I always tell people, if you can, write down some questions that you might have. Write down some concerns. So that way, when the doctor is finished with his or her little spiel, you can say, oh, yeah, by the way, doctor, these are my questions. And it's important, again, for people to remember, is that when you sit down with the doctor, especially in psychiatry, because we know there are not a whole lot of them, the time is ticking then. When they ask you how you're doing, it's not necessarily asking you, how your kids are, how you're doing in school, all that type of stuff necessarily. You can get into that for a minute, but they're focused on why you're here. How are you doing? So how you're doing should be automatically, well, doc, I'm not sleeping. This is what's happening. You want to kind of be upfront with what it is that you need. You don't want to let the service linger, because before you know it, you'll be out the door. The doctor will be standing up and say, okay, well, thank you, and ushering you out the door. And again, you will feel like you didn't get your needs met. But number one, you got to know what your needs are. What did you want when you go into the to the doctor's office? Don't just assume that they know what you want. Hey, I'm here for a refill. I'm here because the medications that you gave me before are not working. I'm here because, I need a referral. Whatever it is that you need, get to it up front, right? That will help your visit to kind of go a little smoother, and ensure that you won't have any, hard feelings when you don't get what you want, or you have to come back. Or the doctor says, oh, well, we don't have time to do that today. Let's go ahead and make another appointment. Well, your mind is like, this is why I came in, but that was not communicated, right? So again, number one, what is it that you that you want? Because when you talk about what it is that you want, when number one, we talk about staff. Some of the things that you can encounter will be staff. Maybe the staff wasn't friendly to you. You felt like they were pushing you, fast through the process, or they wasn't listening. And I'm not saying that doesn't happen, but think about, how can we decrease that? What can we do as a patient to get our needs met and not get caught up in the drama and what's going on with the staff, right? One way is knowing what we want, being clear from the beginning. As soon as you sit down, understand the clock is ticking, right? What do you need from the doctor? What do you need? Hey, this is what I need. Okay, this is what's going on. This is why. Whatever it is, you want to get to the point, okay? Also, be clear when you make your appointment, right? You find out, okay, what are the requirements that you might have? Do you need to have your insurance card with you, or do they already have it? Do you need, any paperwork, whatever else that you need? You want to ask those questions. You want to find out, make sure you know where the place is, right? You want to know, okay, if the appointment is at 10, you want to know if you need to get there a little earlier because you may have paperwork to fill out. You want to be prepared for the appointment. So again, all of this helps to decrease, number one, some of the stress. But staff. So what type of staff? Okay, you've done all that, and let's just say you still get the mental health person or the front desk person just from hell, so to speak. They just, want to make your life miserable. Number one, realize why you're there. Okay? Again, you're not there to go back and forth with the person with the front desk. You're not there to go back and forth with any staff member. You're there to get your needs met, right? So you want to kind of explain to them, hey, what they're doing, how it makes you feel, especially if it's in a clinic. I might say, hey, Miss Jones, the way you're talking to me kind of makes me feel like I'm not important. And you don't have to be angry or rude. You can just say it and make it clear. And then Miss Jones might say, well, I didn't realize that's what I was doing, or I apologize, I was sorry. It's important to communicate. Now, there are ways to complain, because everybody has a boss. If you're going to an agency that's taking your insurance has a way for you to complain about that particular provider, that particular agency, that particular center. So you don't necessarily, you may not feel comfortable complaining at the moment, but you may want to go back later and follow up with a letter. But staff sometimes, right? You may not feel like you're being heard. And that goes back to, again, it's preparing. And again, I'm not blaming you as the patient, because it's up to the mental health staff to make you feel heard. But these are just some tips. to be heard. Know what you're asking for. Know what it is that you want. You know what it is you're concerned. Don't kind of keep going on and on and on, because they will cut you off sometime if they're busy, or you may feel like they're not listening, and that's because they're doing other things. Remember, in a lot of these clinics, a lot of these places, they're backed up. 15 minutes is all you get, and if you got to use those 15 minutes wisely. Sometimes more. Again, it depends on the location, depends on your place. But be clear about what it is that you want. A lot of the problems boils down to expectations. Our expectations that we have are not the same as the provider. Okay, so we want to be clear so we can be on the same sheet of music. Again, how do you get services or challenges you may encounter? Let's just say you're calling a crisis line. Let me back up. Let's just say you're having a mental health crisis, whether it's you or your loved one, and you have to call the crisis line. If you have one in your area, again, every jurisdiction does not have a crisis team. Some do, some don't. So when you call the crisis team, again, what is it that you want? Do you want someone to come out? Do you want to just talk to someone, vent your frustration, your stresses? What it is that you want? Do you want advice? Do you want to know where you should go? What it is that you want? Okay? So let's just say you don't have a crisis team and you have to call 911 if it gets to that point. Again, why are you calling 911? Right? What is it that you want the 911 operator to do? And, I'm having a crisis, a mental health crisis. They're going to send the police, they're going to send the ambulance. What do you want? Right? You want to tell them, okay, I think, it's just a medical crisis. Can you send an ambulance? You don't need to mention the police then. If you mention the police and the police show up, then you may not get your needs met, because the police are going to show up as police officers because you called. Normally when you call 911, it's an emergency and you're saying that whatever is going on is something that I can't handle. So when the police show up, they're coming to handle or look at why you called them. So why did you call? Again, we're talking about some challenges that you might experience, but we're also looking at ways to kind of decrease some of those challenges and just to kind of get us to start thinking about some of these things. So you call the police, they come and they arrest your loved one. So now you're upset with the police. Well, why did you call them? What did you want them to do? What is it that you were hoping that the police would do that you couldn't do, right? So again, these are questions to ask. So if again, what do you want? I think that's so important, because again, it goes back to expectations. Because when the police come, even if the police officer is trained, we have a lot of police officers who take this special training in mental health. I can tell you that even the police officers who have not had the training, quote unquote, mental health, do a pretty good job dealing with mental health crisis. Well, I know people will say, no, that's not true, because you can point to situations where things went wrong. But I can tell you, for every situation that went wrong that we hear about in the news, there were 10 others that didn't go wrong. So just kind of keep that in mind, because unfortunately the police are like the last resort, so they deal with mental health crisis many times a lot more than you do. But again, some challenges you might face, thinking about what it is that you want from the police officer. What do you want them to do? Okay? 911, why are you calling? Okay, it's a mental health emergency, a medical emergency. I want somebody to come and take them to the hospital. Okay? They show up. They may decide that your loved one is not able to go to the hospital, or they may decide your loved one is not sick enough to go to the hospital. What do you do then? So again, thinking through some of these challenges that we might have. So number one, the attitude of providers. Number two, the providers may not do what you feel they should do, which happens a lot. When that happens, you want to ask questions. Why? You want to know what you can do the next time. You want to be clear. You may feel like you're not being heard. Writing things down, sometimes taking somebody with you. Sometimes saying to the doctor, or saying to, because again, no one that's in the helping profession gets into the helping profession to not be helpful. Okay? They might be having a moment at that moment, but if you can kind of just say, hey, doc, I feel like, you're not listening to me. The doctor says, okay, well, tell me, what do you want? Okay, this is what I need, but you have to kind of know what it is that you kind of want. And I'm not saying that you have to be the expert in medications. You have to know specifically, but you have to know in a sense why you're here. Doc, I haven't been sleeping. I've tried this medication. This is what I'm doing. It's not working. This is what I need. My loved one is not sleeping. I want the police come to take this person to the hospital. Again, that will open the conversation. What is it that you need, right? Again, I talked earlier about the importance of support systems. When you have a support system and you are connected to people in the community, especially other community mental health providers, other human service agencies, you get an opportunity to find out what other resources are out there, what other people that you can call to ask questions that can kind of help you with different things. So again, it's important just to kind of remember that when you have problems, you got to ask, is this person always a problem? Is this agency always a problem? If so, you might need to find another agency, because why stress yourself out about a person or an agency that's stressing you out? You already have enough challenges and things to deal with, right? You can find another agency. As simple as that. But if you go to 2 or 3 different agencies or different providers and you kind of find yourself having the same complaint, the same challenges, you want to kind of ask yourself, are my expectations realistic? Are my expectations in line with what the person can do? I need housing, but I'm continuing to go to a mental health agency. Mental health agencies, this mental health agency doesn't have a housing component to it. So if I keep going to mental health agencies that don't have housing, then of course I'm going to be frustrated, right? If you keep going to, you're looking for a particular therapy, and that they tell you they don't have that therapy, and you're feeling like they should have the therapy because they're therapy agents and they should, and they don't, you may feel frustrated when you don't get what you need. So again, it's important to have realistic expectations. Another challenge that you may experience is a backlog. A lot of places now have backlogs because of shortage of providers, which is why it's so important that if you make an appointment, keep your appointment for whatever it is. Keep your appointment, because the appointments are hard to get. So if you get one, some of the appointments are 2-3 months out for a psychiatrist. Some of the places have waiting lists for therapists. Some have weeks for a week or so for a case manager. So it's important that if you get an appointment, keep your appointment. But one of the challenges that you might face is a backlog. Okay, so what do you do if you have a backlog? Again, going back to developing support systems, connecting with human service agencies, I'm sorry. I think I may have said that before. I meant human service agencies in the community. Because while you're waiting for a psychiatrist, you can connect with NAMI, National Alliance for Mental Illness. You can connect with other peer support groups in your area. You can connect with, your church. You can connect with other faith-based organizations. You can connect with other people who can help you while you're waiting to get connected, while you're waiting to see the psychiatrist, while you're waiting to see the therapist, right? So again, it's about taking advantage of the resources that are available, but before you can do that, you got to become aware of those resources. You have to connect with people. So it's important to kind of know that, okay? Challenges you might encounter, medications. You may feel that the medications don't work. If for those of you who are taking medications, again, it's about having realistic expectations. Antidepressant medications don't work quickly. They don't work as fast as some of the other medications, right? So you want to have that conversation with your doctor. If you're having problems with this particular medication, you may have to try another medication. As I said before, you may not necessarily like the provider that you're working with. Why don't you like the provider? Okay, and there's a lot of reasons. It could be the provider reminds you of someone else. There's a transference issue, or it could be the provider's always late. The provider's always, it's one thing to be late, but then give me my entire 15 minutes or 30 minutes. It's another thing to be late, and then for me to feel like you're trying to, rush me out of the office after I waited an hour. So sometimes you may have those concerns. Because again, there's a backlog, and some people are really understanding, and that's great. But at the same time, you don't want to be so understanding that people begin to take you for granted. Okay? Oh, that's Miss Brown. She'll wait. No, my appointment is at 10 o'clock. It's 11. You do this to me every time I come, right? It's okay to be angry and express your concern. To say to the provider, say, hey, my appointment was at 10. You didn't see me until 11. And the last 2 times it's been like this. What can we do? What can I do to be seen on time? Should I make an early appointment? Because again, sometimes you just have to jar that provider's memory, if you will, to kind of realize, look, you're providing a service to people. You're providing a service to people, and if you can't provide the service, maybe you should be doing something else. So, but again, having that conversation. Just like you go into the office and they ask you questions and you share with them, you can kind of bring that back and say, hey, Doc, what's going on? Clinician, what's going on? I've been waiting. Okay, what can we do? How can I help? Having that conversation, because they're human too, just like you, right? There may be different roles, but they're human too. So again, some of the challenges that you might experience, number one, goes back to the person that you're dealing with, the agency that you're dealing with. Number two, feeling like you're not heard, that they're not listening to you, that they already have their mind made up before you get there. 2, 3, getting an appointment, right? It's hard to get appointments. 4, medications, meaning, or getting the right service that you feel that you need, right? I don't want this medication, I want another medication. Know that sometimes it's not the doctor's office or the pharmacy, it's the insurance agency sometimes that's holding things up, just an FYI. So there are various reasons why you may have challenges. It's important for you to think about what challenges are you having, why are you having these challenges, and who can you talk to. What I would not recommend, or I would not encourage you, unless that's just the only place you can go to, is not get into a battle with providers where you start feeling worse, where you walk away feeling like crap, you feeling like they've made you feel so bad and so low that you feel worse. That is not a healthy environment. You need to find someplace else. Okay, even if you have to go to the emergency room or an urgent care clinic, you need to find a place that works for you. You don't need to go where every time you go, you're battling the front desk person, right, who has an attitude. Or you're battling, your case manager who tells you they're going to come and they never show up, right? So again, it's important to realize that you're paying for a service, whether directly or indirectly through your insurance. And if the provider is consistently not meeting your needs or you're having problems, then you might need to look at someplace else. You might need to go other places, okay? But what can you do to decrease some of that? Number one, know why you're going to the provider. Why are you seeking out this particular service? 2, have a support network. 3, write things down. Take people with you if you need to. 5, know the number, your insurance number, because they have it. Whatever, even if you have Medicaid, Medicare, there's a hotline to make a complaint, right? So you want to know what that complaint number line is. Also, be willing to look at yourself. What are you bringing to the table? Are you bringing extra drama? Are you bringing preconceived notions and people are just responding to you? Because if you have a bad attitude, some people will respond to your bad